Allegiance. I pledge allegiance to the flag
of the
United
States of America, and to the
republic for which it stands,
one nation,
under
God,
indivisible, with liberty and
justice for all.
Thank you. Please mute your cell phones, and Doreen, roll call, please.
Amo.
Here.
Anagnostakis.
Present.
Lujan.
Present.
Sutherland.
Here.
Bartel.
Here.
Huey.
Here.
And O'Donnell.
Thank you.
You're welcome.
Commissioner Miller, I think we're gonna, if you're there, we'll do you first, okay? Darcy,
Wonderful. Yes, I am. Good
right.
afternoon, Chairman O'Donnell. How are you?
Pretty good. Go ahead.
Good. So I would just say the behavioral health system has been working very hard. Unfortunately, this COVID experience has impacted people on so many levels and led to, additional emotional crisis. Appreciate our teams across the county who are continuing to provide virtual services as well as expanded face-to-face services. I was speaking in my last meeting, our collaboration with Child Protective Services. We have a expert in substance abuse working alongside of them with very positive outcomes, and really have helped to keep families together and keep parents in treatment so that we have a reduction in children coming into foster care. We are struggling, as you know, with the withholds that were put forward by the state. I included that in my note. Our agencies are having to make tough decisions about their services based on those third quarter withholds, and there's been no relief or update from the state to indicate that they will be restored in the fourth quarter. So we'll continue to wait for that decision making to happen. I'm monitoring it closely. Our 311 call center has been active. We've seen an increase in our substance use calls coming in through the 311 call center. The mobile response team is out in the community doing assessments. I've seen an increase in involuntary transports to the hospital. I think as we have some reduction in COVID response, people are reaching out for help more regularly and following through with hospital assessments as necessary. We have had an increase in our fatalities for overdose, specific to opioids, fentanyl, and we're working to address that. We hired an epidemiologist with the federal funding that came through the Columbia Project, and she will be working specifically to help us fill the gaps and connect with people who are no longer going to jail or being connected with us to the justice system. That's it. Oh, we did get an extension on telephonic and telehealth through September 6th. So another 30-day executive order did come through, and we're still awaiting final legislation that will allow for that long term.
Any questions?
Mr. O'Donnell, Mr. Michael Amo.
Go ahead, Lena. Michael, you have a lot of background in you.
Yeah, I know. About now, I've not.
That's good now. Go ahead, Mike.
Just a question to Darcy. I'm sort of going towards the I guess, people normally in our system. What kind of information do you have on our crisis line calls that we've gotten from people in Orange County in the areas of domestic violence, rape, sexual abuse, etc.? Do you know any? Are you seeing any rise in that now? Is there any trending which you might expect around the COVID?
Yeah, we have seen an increase, on both sides of the operation, but, we don't take the domestic violence calls through 311. Safe Homes takes those calls. But we do, Mental Health Association takes the sexual assault calls, and that we have seen an increase in the 311 extension of sexual assault calls. Some are due to single caller calling multiple times, but we have seen a rise in the need and therefore in the number of assaults that have occurred. I'm just speaking to my Child Protective Services unit this morning, and we have seen an increase in our domestic violence, child abuse response. So police are responding. They certainly would have a better number, as with Safe Homes, as the overall impact. But we know through the services we provide, we've seen an increase in the number of domestic violence calls coming through our multidisciplinary team.
Is there any connection between that and the COVID fact that people are sort of staying at home for so often and all the other things in that area?
There's so many things you could say, the isolation that's been a part of COVID, right? The financial pressures and concerns, children 24/7 in the homes, increased substance use. So often domestic violence occurs more frequently when substances are involved. So all of those things combined together are concerns that we have about safety. Fortunately, I think that other than we're speaking in my last meeting, the data shows April showed a real reduction in all services, not because they weren't needed, but because people weren't reaching out. At least we're getting to a place where people are reaching out again. So I'm pleased to know that people are at least trying to get help right now, and we're trying to be there for them in every way we can.
Thank you.
Okay. Any other legislators? So, Commissioner, I know yesterday that Community Development got a grant for $1,343,670 for homeless prevention, and they're partnering with you. So what's the process, and how much of that money are we keeping, and how much is going to, I know they mentioned some contract with Honor.
Well, let me tell you, the beauty of the partnership that we've developed with social services and community development is most of that money is going right into the hands of people in our community. We aren't keeping any of the money. That's one of the reasons why we didn't want to go through a pass-through. We know how much we're going to need. I know Terry Torchio told me that Mental Hygiene Legal Services said they had 997 evictions pending. Those numbers are just going to go up and up. It sounds like a lot of money until you start looking at 3, 4, 5 months of back rent to keep people in stable housing. The number of families you can help is not nearly the number of families that are going to be needed. So not only is there that money, but there's additional money that's been put into the community that will be added. They're all working together. One allows for 80% of poverty level. The money you're talking about allows for 50% of the poverty level. So we're going to be sure that people are steered where it's best for the money to be put in place to keep them stable housed. The eligibility criteria will be laid out clearly. The forms will be moved forward. We're using, you have to give, I believe, you mentioned Honor, but I believe 2% of the money has to go to CARES. They're the agency that oversees the database that collects all of our homeless data and temporary housing data, not only in Orange County, but across the state. So they will put reports out for us. We're going to make as smart of decisions we can and be sure we're prioritizing the people who are able to maintain their stable housing. So.
All right, so just so I understand it, so who has the final say on who gets it and who doesn't? Because eventually, that, like you said, that money's going to run out.
Yeah, it's going to come in through like a coordinated entry. So we have coordinated entry for homeless services, and there's specific criteria that prioritizes how it goes forward. I mean, there's always some first come, first serve, right? But first come, first serve in eligibility and in need. So all of those determining factors we put in place. It's an excellent committee that they put together under the continuum of care. Nicole is represented, Terry represents us, Mental Hygiene, Honor. They're all at the table, smart people really coming together to make sure that we're using this money the best way possible. And again, simplest way, when it can stay in the hands of county government, we're just putting our resources in as in kind. So we're not keeping any of the funds.
Okay. Thank you.
Sure.
Any other legislators for Commissioner Miller? Thank you.
Thank you. Have a good day. Thank you.
All right. I see the Commissioner of Health and the Deputy Commissioner, so thank you for joining us. We'll go to 1A, which is a request to accept and appropriate additional funds from the New York State Department of Health for the Public Health Emergency Preparedness Grant for the period 9/1/2020 through 8/31/2021 to be used for the opioid crisis in the amount of $72,000. Legislative request number 126. Do I have a motion?
So
Sutherland,
moved.
so moved,
Motion.
Tortel.
All right, so motion by Legislator Luan, seconded by Legislator Tortel. Go ahead, Commissioner.
Thank you, Mr. Chairman. Good evening, everyone. So this is a grant for to be used for the opioid crisis. And as you see in the attached, the contract amount will be for $72,000. There is a work plan and budget that is attached to the template. And predominantly, this will be used toward the employee retirement system, Social Security, fringe benefits, base salary, subcontractor payments, office supplies, so on and so forth.
Any questions from legislators? Hearing none, all in favor?
Aye.
Any opposed?
Aye.
Carried unanimously. Thank you. B is a request to accept and appropriate funds for the American Public Health Association for the Healthiest Orange Farm Markets Grant for the period 7/1/2020 through 9/30/2022 in the amount of $100,000. Legislative request number 128. Do I have a motion?
So moved.
So moved, Tortel.
So that was Legislator Luan. Was that you again?
Yes, Mr. Chairman.
Thank you. And Legislator
And Tortel.
Tortel. Thank you. Go ahead, Commissioner.
Thank you, Mr. Chairman. The Orange County Department of Health has applied for the Healthiest Cities and Counties Challenge in February of 2020. The aim of the challenge, which is sponsored by the Foundation, American Public Health Association, and the National Association of Counties, is to build partnerships to advance health equity and prevent chronic disease. As you see in the attachment, this does include employee chargeback, office supplies in the budget, as well as contracted services with Garnet Health, St. Anthony's Hospital, Montefiore, St. Luke's, Cornerstone, Farm Market sponsors, and as well as some specialty materials.
Thank you. Any legislators have any questions for the Commissioner? Hearing none, I'll call the question. All in favor? Aye.
Aye.
Opposed? Hearing none, unanimous. Thank you. And now we'll go to C. Give us your monthly update, please.
Thank you very much, Mr. Chairman. The Orange County Department of Health has been fully active in its response to COVID-19. There are daily guidance documents that are coming out and continuing to come out, as well as changes in reopening parameters. So we are currently working on those, and that includes schools, that includes the gyms currently, as well as other guidance documents that we're continuously preparing. The department was made aware last week by the New York State Department of Health that the city of Newburgh has been selected as one of the 5 locations in New York State to have testing done on influent water going into the sewage treatment plant. And this pilot study is being done in conjunction with Syracuse University and SUNY ESF. The study will be done with 4 weeks of testing of the sewage water entering the treatment plant, where the amount of COVID RNA entering the plant can be measured. It is hopeful that the testing will give the department some lead time in determining if influx of COVID positive people are currently in those communities, which will help identify clusters preemptively. On a separate note, our Community Health Outreach Division has been very active in continuing public health educational programming, the division recently set up a public health kiosk at the Galleria Mall and is also currently coordinating setting up a kiosk in Newburgh Mall. In addition to giving out face masks to those who need them, the division has been instrumental in helping the public understand state and federal guidance documents on COVID-19. As you can imagine, we are receiving quite a number of calls on a daily basis to all of our divisions. As far as nursing and epidemiology, the nursing and epidemiological divisions continue to work primarily on the COVID response. Immunizations and STD clinics have started back up in Middletown and Newburgh offices. We have not resumed operation for the Goshen Clinic offices. We feel that we have adequate safety measures in place for Middletown and Newburgh currently. A new epidemiologist has started with a division of public health planning and epidemiology, and we are very thankful for the additional support in this unit, which currently is very critical for contact tracing, communicable disease investigations for COVID-19, and this helps us more quickly follow up as well as continue regular syndromic surveillance for all of the other 60 plus communicable reportable diseases. Environmental Health Division is at the midpoint of summer operations. There were a minimal number of children's camps that filed for applications because of the COVID restrictions. Many festivals and events have also been canceled or modified greatly to reduce the size of gatherings. I believe this was offset by the number of complaints that we have had to follow up on, as well as new reopening parameters. So one really balanced the other in terms of operational constraints. Many festivals and events are not going on, but the division continues to respond to complaints from residents through New York State pause enforcement site. And most of these complaints are regarding restaurants not having proper protective measures in place, or large gatherings, so on and so forth, potentially recent travel. We have had several complaints regarding backyard weddings and people traveling from outside the state to attend without proper quarantine measures. So in a nutshell, that's essentially where we are. We do continue to have new cases. It's pretty much a steady stream of new cases, although the overall prevalence rate as far as community-wide transmission remains low at this time.
Okay, thank you. So why isn't Goshen open and Middletown and Newburgh is?
So Middletown and Newburgh has well-equipped clinics, and they have all the safety parameters in place for those clinics. Goshen have the majority of our workforce, majority of our staff actually is within the Goshen clinics, and in order to socially distance the staff that we have here, which is upwards of 80 in the building alone, and we do occupy 2 floors here, we have not resumed reopening the clinics here just as yet.
And when do you foresee that happening?
It will really depend on what we need to do as far as immunizations and the flu. As I mentioned previously, immunizations across the board, especially for pediatrics, are down about 50% from the same time last year due to the closures throughout the local response of the COVID-19 pandemic. And as far as flu clinics, we will start the flu response early, given the fact that the projected secondary wave of COVID-19 is anticipated to coincide with the flu season.
Okay. Can you give me an update on senior centers opening?
Yes, senior centers, we don't foresee them opening at least into the fall because given the trajectory of the pandemic globally and the fact that the potential for the second wave remains quite high at this point, we don't anticipate opening senior centers, obviously, given the fact that that's the most susceptible and vulnerable population, and inherently having any exercise or any type of activities indoors, which has a higher rate of transmission than outdoor activities. Also having that senior susceptible population, if they're having exercises or working out, they're less likely to maintain wearing masks throughout the duration of their presentation. So they happen to be the more vulnerable and susceptible population that is not advised at this time. So we really have to see where we are with second wave and the flu.
Right, so second wave, you mentioned that a few times. So where is the science or the background that we're pretty convinced there's going to be a second wave, and when do you think it's coming?
I wouldn't say convinced, but historically, since the 1700s, there have been 8 global flu pandemics, 4 since the 1900s. The 1918 Spanish flu pandemic, the 1957 pandemic, 1968, and 2009. 7 of those 8 pandemics followed exactly the same epidemiological curve. So if we are to look at the 7 of the 8 pandemics, they have all had a very early peak, which we just passed in New York State. This is something that we're seeing the tail end residually in all of the other states where the prevalence still remains high, and those are the states on the restricted list. So 7 of the 8 pandemics that have had that early peak with substantial resurgence exactly 6 months after the fact. And if we are to examine the epidemiological curve of 1918 influenza pandemic, we just passed that initial bump, and exactly 6 months later, we saw a very steep curve of an increase in cases. And interestingly enough, the global trajectory of cases, if we were to examine them, China has shut down at the beginning of June. About 100 million people were isolated in China, and there were lockdowns due to secondary waves in China. July 7th, Australia shut down, and typically all flu-like illnesses follow the same trajectory. That was the case with the first wave of this current pandemic, and that's the case with the flu season every single year. They start out in Asia, continue to Australia, move on to European Union and the UK, and then continue on to the US. So if we are to follow even the timeline, that timeline correlates with the estimated projections of just historical pandemic influenza that we've seen in the past, not only on the epidemiological curve, but also on the current timeline for the global numbers. So we've seen the original shutdown, China, Australia, EU, and then US. And now for that secondary wave, we have seen the secondary wave shutdown in China in June. We have seen a secondary shutdown in Australia, July 7th. And we have seen preliminary reports now in August from France, Belgium, and some of the European Union countries contemplating potentially secondary shutdowns. If they will in fact shut down and they will have that secondary wave numbers or resurgence in cases, then we are pretty much estimating to have about a month apart from August to about mid-October for the potential secondary resurgence in the US. So this is more historical evaluation and global trajectory of cases currently.
Okay, thank you. Any other legislators have any questions? Legislator Amo has his hand up. Go ahead, Michael.
Yeah, I think you answered the question on the second wave, and that's great. Talk to me a little bit about the flu this fall, this year. What strain, what are we thinking about? How are we looking at it?
So the flu, the Department of Health, and as well as us locally, we have been raising the alarms for flu season, specifically for this year, like no other year, as far as education, prevention, and immunization. Specifically due to the case, obviously, if there is that secondary wave potential, and the flu season will happen concurrently with that potential second wave of the pandemic, we really need to be concerned with immunizing, at least for what we already have on hand, which is the flu. The state has pushed out guidance, I believe, just this morning as far as early immunizations. We have sent out a public health advisory, I believe number 10, if I'm not mistaken, for the flu to all of our providers about a month ago. So all of our medical providers have been notified to ensure that they are increasing not only their education and their outreach efforts as far as flu clinics, but also ensuring that they're making more flu clinics available early on so that we can immunize a lot better than we have in the years past. Because for the population 55 years of age and younger, historical immunization rates in New York State are at around 30 to 35%, when we need to be a lot higher than that this year to ensure that we are reducing that rate of complication and hospitalizations. So we're working very diligently on the informational campaign education. Obviously, we put out the letter to schools very early on. We made that available along with the school documents online right now rather than a month later, which would typically be the timeline for flu letters. So we're really getting that information out there early on because it is imperative to, like no other year, to immunize for the flu this year.
And just to follow up, are you saying it's available immediately now or later?
It will be available as early as, I believe, 2 weeks from now.
Versus September-ish?
So,
Okay.
end of August, yes, beginning of September.
Thank you,
Yeah,
thank you.
absolutely.
Okay, Legislator Tui.
Thank you, Chairman. Commissioner, I just had a question regarding the flu shots, and I see now that they're doing pneumonia shots. The CVS is offering those. I thought they already were started due to the flu also. But my question is, is the pneumonia shot in conjunction with the flu shot for our older residents, is that, can the pneumonia shot portion of it help defend the respiratory against COVID infection?
Against COVID-19, no. So that's an entirely different strain. It does not address COVID-19. But with COVID-19, there is some progress. There are 2 vaccines. I know we discussed this in previous meetings. There are 2 vaccines in phase 3 clinical trials. So they are trying to ramp those up and make it available, at least available by December. That's the projected timeline for COVID-19 vaccination, if all goes well with clinical trials. The question remains of whether that will be available and made to scale for population broad applications in immunization. So that really kind of is a lingering question. But right now, at least as far as testing, just to kind of backtrack a little bit, with testing, we are making quite substantial progress on the scientific frontier, with saliva testing being made available, rapid testing showing slightly better validity. So to answer your question, pneumonia will not cover you or protect you for COVID-19 pneumonia vaccination. However, vaccines specifically for COVID-19 for the COVID corona strains hopefully will be available by December. That's the projected timeline.
Okay, so there's what do you think of the pneumonia vaccine?
I will always respond that vaccination does protect you from diseases. And this year, again, like no other, if you're the person that does not subscribe to flu vaccination any other year, please, at least for this year alone, do so and get the word out there so we can reduce potential for complications and hospitalizations, at least from the flu, if that's what we can control.
Okay, thanks, Commissioner. I just had one more question regarding the sewage treatment plant with testing the effluent waters. Now, with Syracuse University doing this study now, has there been anything before this where that shows as it's promising that that's going to give you a good metric?
Yes, so this happens to be one of those viable tools as far as prevention is concerned, because if we are seeing sporadic positive results on kind of this massive testing, we know that we can focus in that area prior to even having lab confirmed results, because this really addresses, this is something that can prepare us for possibly testing in a certain area and focusing on a certain region. And it gives us almost an alert prior to there even being positive lab results. Because once we receive positive lab results, there's that inherent lag phase between an individual contracting the disease, viably actually incubating it, demonstrating symptoms, and then going to a provider where they're not feeling well enough or they suspect that they have it, to actually testing and then receiving results. So that may be weeks, 2-3 weeks before we're alerted essentially by receiving that lab result. With this type of testing, you're consistently testing, and if you're seeing those positive results, you're now aware and you can alert providers in the area. We can provide randomized testing for that particular region or that particular municipality, and that allows for that prevention component where we can contact trace and isolate and quarantine early on before this has a chance to propagate any further. So this is kind of an early alert, early response. And just to answer your previous portion of the question, this has been implemented in other countries, and it has also been utilized, I believe in New York State, Madison County, if I'm not mistaken, was the first one to just kind of test it initially. And Syracuse is now trying to have kind of those secondary test models.
And then if they do, if it does come back with positive efforts, would they be looking to expand that around the state, or how would a sewer how would a sewer plant or a community try to get on the list? You know, down here in Monroe and at the Harriman wastewater treatment plant, it serves that plant serves a very diverse group of residents, large numbers, and you know, I think we'd like to be put on that list somewhere along the line.
So this was, the sites were randomly selected by New York State, and we just lucked out, and I would like to think that we had something to do with it, with really promoting that if they at least choose one site in Orange County. But ultimately, I believe 5 sites altogether were chosen New York statewide, with one of them in Orange County, which happens to be Newburgh. Hopefully, the true hope of this is that if this does show a positive correlation, where this is a metric that has some preventative value, that it will be scaled to size. Now, whether or not New York State will make it available and pay for that effort, or this is something that will be offered to counties, I don't know that component just as yet, because as you're well aware, funding is kind of a separate criteria. But as long as there is a clinical or preventative population health value to it, I would imagine that the goal is to scale it to size and make it available.
Okay, great. Thank you.
Thank you.
Thank you. Legislator Sutherland.
Thank you, Chairman. Commissioner, as far as the flu vaccine goes, with it becoming available the end of the month, beginning of September, is that pretty much standard across the board in the state, the country? I'm thinking of college students who, you know, left and haven't been able to get it, but once they're at school, there are already so many restrictions as far as, like, will college campuses have the vaccination for them? Will they need to go to their local CVS or pharmacy? And will that be available across the board throughout the state?
So I know for a fact the state is making every effort to make vaccines readily available statewide to ensure that we are ramping up our immunization numbers for the flu. As far as nationwide, I know that they were attempting to scale that to the population wide and have pharmacies purchase more than they typically would to ensure that this is readily available pretty much anywhere you go, and pharmacies have been a conduit to that. Nationwide, I can't attest to, but New York State is making every effort to make this broadly and widely available, and not only broadly and widely, but also early on, much earlier than we would typically. And by that, I mean at least a few weeks earlier than we would usually have it.
Okay, thank you.
Thank you.
Any other legislators? Okay, thank you, Commissioner, Deputy Commissioner, thank you.
Thank you very much.
Thank you.
Have a good
Move
one.
on to Commissioner Ledoux at Valley View. See, he's with us. So we'll go right into A, request to accept a donation in the amount of $3,000 to be used towards the purchase of a theater system for the residents of Valley View from the Michael and Erin Martucci Family Foundation, 30 Scotch Corners Drive, Suite 203, Montgomery, New York. Legislative request number 137. Do I have a motion?
So moved.
So moved.
Seconded by Legislator Tortel. Thank you. Go ahead, Commissioner.
Good afternoon, everyone. Yes, we were approached by the Michael and Erin Martucci Family Foundation. They reached out to us during the COVID crisis, and they wanted to make some type of donation to Valley View. This is what they along with us decided on doing, to do something for our residents in the near future. And we obviously have to bring it to the committee's attention for approval before we do anything with it.
Okay, thank you. Legislator Sutherland. You have your hand up, or is that from before? Perfect, it's down. Any questions for Commissioner regarding their $3,000 gift?
Yeah, Chairman, it's Tui again. Just was wondering, Lawrence, what kind of theater, how they envision it? Would it be in the town hall area?
Yeah, I think it's going to be in town center. It's probably going to be a large retractable screen with a projection system.
Great, thank you. That sounds good.
You're welcome.
Any other questions? Hearing none. All in favor?
Aye.
Any opposed? Hearing none, unanimous, passed. Now we'll go to our monthly financials. Go ahead, Commissioner.
Okay, if you start on the top of the first page, you'll see the 2020 year-to-date actual. I'll just go down all those numbers right now. Year-to-date, we have IGT revenues of just over 2.2 million. We have emergency disaster relief fund funds that we received just under 1.9 million, and other revenues coming in at just over 21 million for a total of 25,402,041. Personal services are coming in at just over 13 million. If you compare this number compared to last number, there is an extra pay period in 2020 versus 2019. So in August, we will catch up and we'll be on even pay periods. So that's why the number is a little higher. Equipment is coming in at 131,000. Contractual expenses at 5.4 million. Employee benefits at 10.65 million, and debt expenses of 92,000 for a total expenses of year to date of $29,732,091.
Okay, any questions? Seeing none, go ahead.
And then we have, excuse me, the next page, excuse me, is the analysis of the bill days by payer source. I'm not sure if that's the next page or the census is, but the analysis of bill days by payer source. We have Medicaid revenues coming in at 81.58%. If you add in the first two numbers, Medicare revenues are coming in at just over 14%. Private pay revenues at almost 3.5%. And then the last page is the occupancy for 2020. And you can see that July we were at 82.55%. The census so far for August is 81.74%.
So we're still looking like we're going to be down 10% for the year.
I'm hoping not for the year. I mean, we're down 10% right now. I'm hoping, you know, we gain some ground the next couple of months. I was cautiously optimistic after last month because we moved up a couple of percentage points. Now we're kind of flat, so we'll see.
Chairman, you froze up.
Leader Amo, go ahead.
Yes, Mr. Chairman. Lawrence, we discussed with Darcy earlier in the previous meeting the impact that the new regulations on Medicaid home care would be, and one of the implications that may drive people to nursing home admissions because of the delay, lag, and approval. Do you envision that? Do you anticipate that? And if so, what do you plan to do about it?
Yeah, that certainly can happen. We already have a long waiting list for long-term Medicaid admissions or any long-term admissions. So I just suspect, unfortunately, that list is just going to get longer. So we don't have issues with our long-term population, as you can see by our 81%, payer type. The issue we're having right now is the hospital is not doing the same business as far as the short-term rehab and the elective surgeries as prior to COVID, and that's what's really hurting us. So yes, it could drive people to apply for long-term placement in nursing homes, and it'll just make our waiting list longer than it already is.
Thank you.
You're welcome.
All right, go on to the monthly update, please.
Sure. So currently we have no active COVID positive residents in the facility. I did mention our census. We are taking admissions, both long-term and short-term. The New York State Department of Health back in July did put out an updated directive regarding visitation. We're only having visitation inside the building for end-of-life cases. Visitation is allowed for family members now outside, and it's supervised. We had a staff member test positive for COVID in July, and one of the regulations states if a resident or a staff member tests positive, you have to push back your visitation days 28 days. So as a result, we just resumed visitation again on August 13th last week. And I did put in here that there's a total estimated negative financial impact to Valley View for COVID is currently $2.5 million. 485 of that is in expensive, and 2.1 million is in lost revenues.
Any legislator Tui, go ahead.
Thanks, Chairman. With regard to the, if there's a long-term waiting list that we're waiting to go through, is there anything preventing you from bringing them in? Because if we're at 82% for the census, it sounds like we do have some room, but I just wondered if you had other restrictions or something that was preventing you from moving through that list.
Well, we don't want to bring them in on our short-term units because then that'll reduce our chances of increasing our Medicare census. So we don't want to occupy all of our short-term beds with long-term residents. And we are, when we take in a long-term resident, we're trying to put them in a room either by themselves and then keep them there for 14 days so we can ensure that they're, we can clear them for the COVID precautions. So it does take a little longer right now to take in a long-term admission than it currently did.
Okay, so that extra buffer you have is really the capacity you would be using if you had elective surgeries and such going on now. But
right.
You need to keep those in place. Okay, thank you.
You're welcome.
Leader Amo.
Yeah, Lawrence, this is, I know you sent us out some information regarding the focus survey visits on infection control. And congratulations, apparently we're doing well. For my ears, could you give me a little bit of a description of the infection control program, or maybe schedule another meeting that you have at Valley View that they're surveying against? It seems to be a hot topic in the New York State Senate and the Assembly now, so it'd be interesting to know what it is you're talking about.
Sure. So they're typically when we have a recertification survey, they're looking at all the regulations that we have to follow, and they do look at infection control as well. But on the focused infection control survey during the pandemic, it is primarily focused on infection control. They want to see if we have proper signage throughout the building. They want to ensure that all of our staff members are wearing masks. They want to see hand sanitizers, washing hands signs all over the place. They want to see our staff utilizing the proper PPE. All those sorts of things are under more of a microscope than they normally are during a recertification survey. So they just want to ensure that we're following all the new New York State Department of Health directives regarding COVID prevention.
Lawrence, who's your point person in infection control? Is it just a supervising nurse, or do you have a separate infection control nurse?
So you have to have a designated infection control person that's responsible for the program, and our person is Beth Perda, and she's one of our assistant directors of nursing.
Okay. And they do all this, and then through that office, they do all the surveillance?
Correct. Yeah, and she reports she does an infection control report monthly. She reports on any and all the infection control, any and all the infections that we have going on through the building monthly, and then she works in conjunction with the staff development department to ensure all of our in-servicing and so on is up to date.
Great. Thanks a lot.
Thank you.
Chairman, question?
Go ahead, Legislator Nagastakis.
Thank you, Mr. Chairman. Lawrence, you mentioned, and I did see it when I looked through the financials, that the impact of the facility dollar-wise is about $2.5 million. but does that or does that not factor? I didn't think that factored in the 1.9 million we're getting in relief.
That doesn't count the 1.9. I mean, if you take that 1.9 and you take, put it against the 2.5, I guess, technically we're down 600,000. We are tracking all of our COVID expenses and all of our COVID lost revenues. We have to report on that 1.9 million, what we're using it for. So, we're tracking all these things. So it's just a good piece of information to what COVID actually cost Valley View at this point in time.
Right, but would it be a better way to think about it would be that the facility has suffered because of COVID virus, 2.5 million in its operations, so we're in the red by 2.5 million, but we do have the 1.9 million of relief payments coming in to offset that.
Right.
Okay, thank you.
Yep.
Any other questions? You have anything else for us, Commissioner?
I think that's it. The family members have, really been very supportive considering they haven't been able to come here for quite a while. So I don't know if any of the legislators have gotten any complaints, but, we're just really just following the Department of Health guidelines. So, as long as we remain COVID free, the family members can can continue to, come and see their loved ones. So that's about it. Just so you're aware. I don't know if anyone's got any calls or complaints. For the most part, they have been very supportive. So
No, I haven't got any complaints here. So if
Good.
anybody does, please let us know.
yeah, I mean, the point is just we have to follow the guidelines, and we're not making up the rules, but unfortunately, we have to follow them.
Correct. Okay, thank you very much.
Thank you.
Ask for a motion to adjourn.
So moved, Tortel.
Second, Lujan.
Thank you. Enjoy the rest of the evening. Meeting adjourned.
Thanks,
Thank you.
Chairman.
Take care, Chairman.
Thank you, Chairman.